I'd like to introduce the speakers for the session. Larry V. Hill is the Senior Manager of Risk Services with Palms and Associates, and Jim Bautier is the Senior Manager of Safety and Security with Palms and Associates.
My name is Larry V. Hill. I'm with Palms and Associates. I'm the Senior Manager for Risk Services. We are the contractor for the New Mexico Public School Insurance Authority. We provide loss control services to NPSIA and all of its members. And with me today is my associate, James Bautier. He's going to be helping me and assisting with some questions that we may have during this presentation, and also providing moral support for me. So thank you very much for attending this morning. Before we begin, I just would like to, first of all, acknowledge and appreciate all of you for being here, all of you for being educators. Know how important this topic is to all of you as you're getting ready to re-enter schools. There's a lot of anxiety, a lot of questions about, how to properly do some of these things like cleaning and disinfecting. So I'm hoping that this session is going to give you an opportunity to ask as many questions as you'd like. Feel free to jump into the chat box. If there's a particular point in time that you'd like me to stop the presentation and answer a question, I would be happy to do that. I would like this to be interactive if possible. And so before we begin, I'd like to find out kind of who's here in the room with us today. So I think we've got a poll that's going to go up regarding occupation or position, so we can figure out who's who and who we're addressing in this particular session. Okay, great. So we've got administrators, nurses, teachers, and social workers on with us. That's great. So a lot of this is going to kind of be preaching to the choir when it comes to what we're going to be addressing in terms of the information topics that I've got in our presentation. However, if there is a specific question that you'd like to ask, like I said, feel free to interrupt and jump in at any time. So we're going to talk about some things that you've probably done a lot of research on. A lot of you have probably already read a lot of the information that's out there from the CDC, from the EPA, from PED with regard to the reentry requirements. But we're going to talk about how we can safely clean and disinfect our schools. So in doing so, the first thing that we need to do is define. Let's see if I can move on here. Again, so just a quick disclaimer, this information that we're providing is for information purposes only. There's not any kind of regulatory advice that we're giving in here. You want to make sure that you're specifically referring to any New Mexico law, New Mexico public health orders, all federal and state guidelines. But this information that we put together is based on EPA, CDC, and the New Mexico PED reentry requirements. So this is for information purposes, but we want to make sure that we're answering, whatever questions we can from a loss control perspective. So we're talking about risk. And before I even jump into these topics, I'd like to talk a little bit about risk and what that means. So let's think about risk and what it is that we're trying to accomplish when we're looking at safely cleaning and disinfecting our schools. First of all, if we think of the risk associated with what's going on with the pandemic, with the virus that we're dealing with, think about in terms of how we can reduce or completely eliminate risk. The only way to do that is by staying in our homes and not leaving, right? As soon as we leave our homes, there's going to be some inherent risk associated with that, whether it's traveling to the grocery store, going to work, wherever we're going, there's going to be some risk associated with the virus. What we're trying to do when we're talking about safely cleaning and disinfecting schools is bring one piece of the puzzle to the table for how we're going to handle and manage that risk. So we also want to make sure that we emphasize the importance of things like social distancing, hand washing, good respiratory etiquette. Those things are going to be just as important as safely cleaning and disinfecting schools. When we look at cleaning and disinfecting our schools, when we start to do that process, it's only as good as the last time we wiped. As soon as we wipe a surface, whether we're cleaning it or using the product to disinfect that surface, as soon as somebody comes in and touches that surface, breathes on that surface, talks while they're sitting near that surface, we have the risk of respiratory droplets landing on that surface or contaminants landing on that surface, and it's no longer disinfected at that point. So again, the only way that we can completely eliminate that risk altogether is if everyone just stayed home. But the fact that we are going to be reopening and we are going to be going back into our workplaces, going into schools, we need to manage that risk. This presentation will hopefully help you bring that one piece to the puzzle, which is the cleaning and disinfecting, but I want you to think about all those other methods as well. In fact, the #1 way to keep germs from spreading is to teach good hand washing, using plain soap and water for hand washing before eating, using the bathroom, recess, anytime that kids get dirty, anytime that we as adults get dirty, we want to make sure that we're using soap and water to remove the germs and remove any potential contaminants from our hands before we touch any surface, including our masks, as we're putting on our face masks. So before I start going off into any kind of rabbit holes with regard to that, let me refocus here back onto our presentation, which is cleaning and disinfecting. We're going to talk about the difference between cleaning and disinfecting, the CDC guidelines. EPA has a list of products called List N that they made available, which has approved products for cleaning and disinfecting. And we're going to talk about different strategies to help maintain a healthy environment. So let's jump in here. And like I said, if anyone's got questions, feel free to jump in anytime, because I know a lot of this may be repeat to you. It may be something that you've already seen and looked at. But if we look at the definitions of cleaning versus disinfecting, cleaning is the removal of dirt and impurities, including germs, from surfaces. Cleaning removes dirt and most germs, and we use soap and water for cleaning, or cleaners, products that are listed as cleaners on the label. That will alone, cleaning by itself, can remove most germs, doesn't necessarily kill the germs, but it will remove germs and decrease their number, therefore the risk of spreading infection. So cleaning is important. Disinfecting is also important, and disinfecting is when we're using chemicals. It works by using chemicals to kill the germs on contact. Now, the time that it takes for germs to be killed varies from product to product, and so that's what we're going to talk about: how to choose the right product, how to read the label, how to understand the information that's on those labels, so we can understand what it is that we're doing when we disinfect versus when we're cleaning. Cleaning surfaces using soap and water, daily sanitizing of surfaces, and frequently touched items. These are things that the CDC is recommending to help maintain healthy environments. We want to clean and disinfect frequently touched surfaces within the school or on school buses as directed, at least daily, and between use as much as possible. Now, does that mean that we're going to run out and use chemicals on desks every time students get up and walk out of the class into another classroom? Not necessarily. It depends on your situation. It depends on the availability of the cleaning products that you're using. It depends on how much dwell time is involved with the use of that product, how much ventilation is going to be required. All these things need to be taken into consideration when you're setting up your cleaning schedule, when you're determining what items you're going to clean and disinfect, how frequently, and how often these things are going to occur. Cleaning works by, again, removing dirt and organic matter that contains and protects germs. We use soap to break down oils and dirt, contaminants, and other germs so that they can be easily removed. After cleaning, oftentimes the label is going to require wiping. So we want to make sure that we're following the directions carefully on the label with regard to wiping. Wiping can be done using different methods. We can use things like a microfiber cloth, for example, which is one of the best practices that cleaning companies will advise you on. Microfiber cloths allow for the breakup of the dirt and the grime that you're trying to wipe, so that the surface becomes clean before you apply any kind of sanitizer or disinfectant, any kind of disinfectant or sanitizer. So a lot of different terms that we're throwing out here. Disinfection works by using chemicals. The EPA has a list that I referred to of cleaning chemicals. This is what List N from the EPA website. These are disinfectants that are for use against SARS-CoV-2. There are only 2 products that have actually been approved by the EPA, which are actually proven to kill this particular strain. So there's a lot of research that goes into registering a product. These products have been registered under List N for use against CoV-2, but they've not been necessarily proven for its efficacy against that particular virus. So you won't find on the label of a product, except for those 2 that have already been approved, that they will kill COVID-19. They say that they'll kill different types of viruses, including COVID viruses, but there have only been 2 that have gone through the entire process of being approved by the EPA. Many more will follow, but the first 2 that are out on the market right now are both made by Lysol, and I'm not endorsing any particular product. I'm just talking about what's available on List N of the disinfectants for use against COVID-19. So even though the products aren't necessarily registered specifically for that, we still want to use the disinfectant to kill viruses. Okay, so we want to use something that's listed on the EPA registered list. Now, when you're taking a look at that, there are some things to keep in mind. You're always going to want to refer to the label the product label is going to tell us what are the hazards associated with that chemical. Okay, there are different words that are used on a label which kind of help you determine which particular product you want to use. The words on the product label that you want to look for are either caution, warning, or danger. If you see a caution on your label, that's something that your product is telling you that there are certain actions that need to be taken when you're applying the product for cautionary purposes. In other words, it might tell you that you want to wear a certain sort of PPE, gloves, mask, breathing apparatus when you're using that product. A warning is telling us that it's a little bit more dangerous than the caution. So the caution is kind of the low level. Warning is telling us that there are health warnings associated with the use of this product. And danger is just like it sounds. If we use this product, it could potentially be dangerous to our health. So the three words vary in range from caution to danger, caution being the lowest to danger being the highest. So when you're selecting your cleaning product, that's something to keep in mind. Take a look at the label and see, does it have the caution label? Does it have warning? Does it have danger? And if it does, then we need to take those extra precautions that the label is telling us to take. In schools, usually your custodial staff are the people who are responsible for using disinfectants. And that's because they've been trained on the hazards of the chemicals that they're applying. They've been trained on the personal protective equipment necessary for using those chemicals. And they've been trained on all of the different precautionary measures that need to be taken. So your custodial staff is primarily going to be responsible for that. And in the past, we've only focused on the high risk areas like the nurse's office, your bathrooms, cafeterias, eating surfaces, kitchens, drinking fountains, but we want to now start looking at other high frequency touched items like door handles, light switches, desks potentially that kids are sitting on that are now becoming eating surfaces because we're advising, or the EPA, CDC, PED are advising when possible, maybe having meals delivered into the classroom. So now your desks are becoming eating surfaces. And those are areas that we want to make sure that we're increasing our frequency of cleaning and disinfecting, but making sure that we're taking those precautions when we're using those disinfectants. So our school custodians are usually going to be our front line on that. However, if other staff are going to be responsible for that, if the responsibility is going to lie outside of just the custodial staff, we want to make sure that we're training those employees on the safe use of disinfectants, making sure that we understand how to read the labels, what those different cautionary words on the label mean, and how to properly apply the product. So for example, you might be using a product that has a dwell time of 4 minutes. Well, that dwell time is the amount of time that the product needs to stay wet on that surface in order to efficiently kill the virus that it's intended to kill. If 4 minutes is your dwell time, we got to make sure that no one's going to be able to come in and touch that surface for that amount of time. So are we going to disinfect? Again, what time of day are we going to do that? When are we going to be using that process? Some of the best practices that we're hearing from different vendors, from the cleaning suppliers, from the contractors who are going in and cleaning and disinfecting, are to just take a look at your current cleaning schedules as they currently exist. Take a look at your cleaning schedule currently, and then figure out where we can increase frequency, but minimize the risk of those disinfectants being harmful. So for example, one thing that we can do if school staff are going to be responsible for cleaning, maybe you can have your custodial staff mix a solution of soap and water in a spray bottle for teachers to use, for classroom attendees to use to clean in between use. The soap and water is not going to be as harsh as the disinfectant. It's not going to have the same cautionary statements on it. It's still going to be effective in removing germs. It's not necessarily going to kill germs, but it will help remove germs. But that, in conjunction with our hand washing, our respiratory protection that we're using, will help minimize that risk. Are we completely and totally eliminating the risk altogether? No. Like we talked about, it's impossible to get that standard. So what we have to do is figure out the best practices, the best methods to be able to clean and disinfect safely within your schools. You want to read your label carefully on any products that you're applying. But if you're using the method of cleaning in between use with soap and water, then we want to increase our disinfection at certain periods of time, certain intervals. So if you look at maybe disinfecting at the end of the day when students aren't going to be there, when we can properly ventilate the classroom, we can open windows and doors, use those products the way they're intended to be used by the staff who have been trained to use those products. Now we reduce that chance of somebody getting sick or something happening to somebody's safety as a result of the products that we're using to either sanitize or disinfect. So again, disinfecting is usually the responsibility of custodial staff, but if trained properly, other staff members can do that. We want to make sure that we're cautioning towards the training aspect of this and using products as they're intended. So something that we can also use are cleaners. In addition, if we're not going to use soap and water, there are cleaners that can be purchased from your custodial companies, from Brady, from Fleming, from whoever it is that you're purchasing products from. You can buy cleaners that aren't disinfectants, that aren't going to have the same harsh chemicals in them, but will also effectively eliminate and help remove the germs from surfaces. There are certain products out there, green cleaners available, that also help with things like asthma. I know, especially our nurses that are on the line, you have a big role in this because you know the health history of the students. You know which students potentially have breathing issues. Those are areas that in the cleaning plan you should be advising, you should be providing input in terms of what types of products we're using in what rooms. I talked about the list N from the EPA. On that list N, you will have all of the labels associated with all those products. So the first thing you want to do when you're developing your cleaning plan is to first look at what your cleaning schedule is and what type of products you have currently in stock. Take a look at those, inventory them, and compare them against list N to determine are they going to be able to be used for sanitizing against COVID-19. If they are, then we're going to include those. But again, we want to make sure that we're following the labels for the contact time, the dwell time, and the ventilation necessary for using those products. So develop your plan by checking your current inventories. Look for products that are already on hand that are on list N. You can also refer to a list from the EPA called the DFE that's designed for the environment. Some products that are on the DFE list have less harmful chemicals in them, but they're still approved for use against COVID-19. So you do have some cross-reference between list N and the DFE list to help find those products that can still be used as disinfectants that are safer and more effective, and when you've got people with breathing conditions, asthma, or anything of that nature. So we want to make sure that we're using that process to develop our cleaning plan. Are we going to clean in between groups, for example? Maybe when we're doing if you're doing the Monday, Tuesday with Wednesday for deep cleaning, then we want to save the disinfecting for a time when we know that we're through with one group. So if you're doing Monday, Tuesday, cleaning on Wednesday, that would be a great time to use the disinfectant on the Wednesday. Then Thursday, Friday, the kids come back in. Over the weekend, we disinfect again. Or disinfecting at the end of the day also is effective. So there's different methods, different approaches to that topic. Some other things that I want to bring up in this session are personal protective equipment. Whoever's using those cleaning products, whether it's a sanitizer or a disinfectant, we want to make sure that we're referring to the label for any personal protective equipment that's required. A lot of these cleaning products say that you should be wearing gloves, that you should be wearing something for breathing, so that whether it's a face mask, an N95, there are certain personal protective equipment that's required for use of a lot of your cleaners and a lot of your disinfectants and a lot of your sanitizers. You should, if you're wearing even if you're wearing disposable gloves, you should always wash your hands after you've handled products. Pay particular attention to your labels with regard to eating surfaces. If the disinfectant says it's not appropriate for an eating surface, or if there's an additional action that needs to be taken to make it ready for an eating surface, we want to pay particular attention to that, especially if we're using these disinfectants on desks or tables and kids are going to be eating from their lunch at that particular station also. We don't want to put our bologna sandwich down on the sanitization or on the disinfectant that we just used and potentially make somebody sick from that. So is there a wipe? Is there a post-cleaning wipe that's necessary? If so, we want to make sure that we're following those directions, and that's all going to be available to you on the product label. Product label is going to be necessary for everyone to read and understand. Wash your hands often. Follow all of your product label directions. I want to also talk about alternative cleaning products or homemade remedies. Okay, it's often tempting for us to think about, the things that we're using at home being effective and bringing those to work or bringing those into the school environment. Well, what potential hazards are we creating if we're allowing staff to bring in their own cleaning products? Some of the things that we don't think about, we often hear about bleach and ammonia mixing together and what kind of effect that can have. But did you know there are also other cleaning products that when mixed together can create hazardous situations. For example, bleach and vinegar. If you mix bleach and vinegar, you can produce a chlorine gas, which causes coughing, breathing problems, burning, and watery eyes. Bleach and rubbing alcohol can form chloroform, which is highly toxic. And hydrogen peroxide and vinegar, that combination makes an acid which can be highly corrosive. So how do we know if the product that we are bringing in from home contains any of these things? You need to read the labels. How do you know if those are going to be inconsistent with what the school is already using for cleaning and disinfecting? That's why it's important not to bring your own home remedies in, including things like essential oils and natural products that maybe you've read about, heard about on the internet. How can those chemicals mix with the chemicals that are already in existence? That's when we have hazards that can be created. We also don't have the labels from those things that you're bringing in. We don't have the safety data sheets. So everyone in the work environment is now exposed to an additional exposure that we don't necessarily have the proper precautions for. So we want to make sure that we're not mixing cleaning products unless we've been trained to do so. And we shouldn't be bringing cleaning products in from home because of the risk that's associated with those chemicals mixing with the chemicals that are being used in the school. So leave the mixing of products to your custodial staff who has been trained on how to properly mix if there's a dilution that needs to take place. For example, a lot of your sanitizers, a lot of your disinfectants come in large quantities, which are then diluted into smaller spray bottles. That should be done by your custodial staff who's trained to do that. I want to talk a little bit about wipes. Clorox or any kind of disinfecting wipe. These are very common, especially on our school supply list. I remember when my kids were growing up, this was usually one of the essential items that was on the school supply list. We'd send in a box of wipes. So let's talk about wipes and using wipes for disinfecting. So first of all, I want you to notice one of the things that's on this label under the precautionary statement here. First thing that we see here is this is hazardous to humans and domestic animals. So who's going to be using these wipes? Humans are, right? So we need to read the label to find out how these are going to be harmful to us, because we know that this tells us that there are hazards. The other thing that you'll notice on a lot of these products, one of the first statements that you'll see on them is, trying to find that statement here, keep out of reach of children, right down here at the bottom. So who should be using wipes? Who should be using these types of products? Not children. Adults should be responsible for using wipes. Okay, so when we're using wipes, some things to keep in mind, some things to consider. First of all, the label. What is the label telling us about these wipes? This is a disinfecting wipe, so we know that there are chemicals in it because it's disinfecting. It tells us that this will kill germs. That statement can only be made on disinfectants. I forgot to mention when I first started this presentation, disinfectants are actually pesticides. Pesticides that are registered with the Environmental Protection Agency. So disinfectants contain chemicals that will kill germs. They will kill living objects or living organisms such as germs, viruses, bacteria. They're pesticides. So it's the same types of products that also kill pests. And viruses are considered part of that. So they're all approved and registered through the EPA. So when you see a statement on a label that says that a product kills germs, that means they've gone through the registration process with the EPA. And you can actually go down into the information on the label and find the EPA registration number. You can look it up on that list N and find out if this has been approved as a product to kill germs or to kill the virus associated with COVID-19. So once we've determined if we're going to use these or not, one thing that we want to read on this label here are the directions for use. The first thing that on the directions for use, it says, it is a violation of federal law to use this product in a manner that's inconsistent with the product's labeling. So if it says keep out of reach of children and it's a violation of federal law to use these inconsistent with the product labeling, that's another deterrent for why we shouldn't be having students use these wipes. Okay, it's a violation of federal law. It's unsafe for students to apply the wipes. Now, a lot of people just think, if I wipe a surface with one of these wipes, it's clean. It kills the virus is now killed from the surface just by simply wiping it. That's not necessarily true. What we have to do is read the label here and find out what it says to do for different types of use. So this particular chemical, for example, it's a disinfecting wipe. It can be used to clean surfaces. If I take this wipe out of the bottle and I wipe a surface with it, if that surface now is touched, or if it's dry, it becomes dry by wiping it, it's now clean, but it's not necessarily sanitized or disinfected. I need to go down to the next step, which tells me sanitization. To use this as a sanitizer, I need to allow for the product to be wet on the surface for at least 30 seconds, I believe is what this particular label says. And I can't read it because I can't zoom in far enough to it without my reading glasses on. So each product has a different amount of time. It's called the dwell time, that the product must remain wet on the surface. So we wipe with this particular product, we need to allow it to sit on the surface for up to 30 seconds for it to sanitize. To disinfect, I need to allow for the product to remain wet for 4 minutes with this particular product. And we can look at other brands here, or other labels. Again, this one kills 99% of viruses, so I know this has been approved by the EPA. It's got an EPA number somewhere on it. But to sanitize, this one says to use to sanitize, deodorize hard, non-porous, non-food contact surfaces. I can wipe the surface with this, allow it to remain visibly wet for 10 seconds, and let the surface dry. So should I wipe my desk with this particular product and then eat my bologna sandwich on it? No, it says right here, this is not intended for food contact surfaces, to sanitize on non-food contact surfaces. So that's where you got to read the label to find out, is this particular product safe for using on food surfaces or not? You're going to find that information by reading this label. And we want to follow the directions on it. To allow for, this one says to allow to remain wet for 4 minutes, allow surface to air dry, and toss the dirty wipe away. Other disinfectants might tell you to wipe before you apply it to clean the surface, wipe it, allow the product to remain wet, and then go back and do another wipe to remove any residue that may remain on the surface. So every product is different. We need to follow the label for each of our products to make sure that we are that we're doing this properly. Some other things to keep in mind with regard to our wipes: disinfectant wipes are often overused. They're not appropriate for general cleaning when an all-purpose cleaner or soap and water will suffice. So if we're saying let's clean those eating surfaces before we eat on them, that doesn't mean using a disinfectant wipe or using a disinfectant product unless we're using it in accordance with the label. Okay, so we're not only potentially causing hazard, but we're not doing what we're intending to do, which is kill the virus, if we're not following the labels exactly the way that they're intended to be used. Disinfectants can give a false sense of security because they do tend to become overused. We start to think that we're now creating some sort of barrier. There are no residual products out there that are approved by the EPA. In other words, there's nothing that's been approved by the EPA that we can apply to a surface that remains for a certain amount of time that we know is going to create any kind of barrier to the virus. As soon as the next kid comes in, or as soon as anyone comes and touches that surface, it's now contaminated again. So there are no barrier devices, no residual devices that are out there available, despite what you might be hearing from certain manufacturers. There are some manufacturers that are saying that they've got products that do create a residual effect. Those have not been proven and tested by the EPA to validate those statements for viruses. There are some products that reduce bacteria growth, but not necessarily for virus growth. So we want to make sure that we're reading labels, following those directions, and not developing that false sense of security. More important than using the disinfectant before somebody comes and eats lunch on their desk is have them wash their hands. If they're washing their hands, now we're removing those germs, those contaminants from our hands before we even come into contact with our surface that we've already cleaned. Now we're ready to eat our meal. And again, after we've contacted our mouth, wash our hands again. We're going to be doing a lot of hand washing this year. And you know, this is a good thing because it's probably what we should have been doing all along. And I'm preaching to the choir with the school nurses here. If we had been doing these kinds of things, maybe flus wouldn't have been as bad. Maybe absenteeism from other types of colds and viruses wouldn't be so bad if we were taking the same precautions. So one thing that we're hoping to see is a reduction in that. But I'm going off on a tangent here. So again, following your directions for your disinfectants, let's talk a little bit about bleach. Bleach is stated on the EPA's website as an alternative when disinfectants aren't available, but I want to make sure that we really caution people on the use of bleach. Bleach can be used, however, it's very important that the label is read and followed exactly according to the letter, because bleach is one of those products that has that word there, danger. So right off the bat, we know this is the most hazardous or the biggest risk that we're taking when we're disinfecting is using bleach. This one is dangerous. It's dangerous because it's a corrosive, which means that it can break down materials. If we apply this product to certain types of surfaces, we could actually damage the surface. It is a corrosive, which means it can damage our skin, can damage our tissue. It's an irritant, so it can get into our nasal passages and cause breathing problems, can cause eye issues if it gets into our eyes. So it's a very dangerous product, and we want to make sure that we're using it in accordance with the label directions. And again, this would kind of be something as a last resort. If you don't have other products available, I would say that's when we would turn to bleach and make sure that anyone that's using bleach is trained on the proper usage and application of it. Some other things to keep in mind. You want to make sure that you're reading the label and finding out that it's got this statement on here that it's certified or that it's been approved to kill germs. It's 99% effective on germs. Some bleach products aren't necessarily intended for that purpose, and especially if they've got any kind of additional scents, gels, additives, things that have been included with it, it now could reduce the efficacy of that product for killing germs. So you want to read the label and make sure that it's intended for use as a disinfectant, and you'll find that by reading these directions, by reading your precautionary statements. It's going to tell us how to use it as a disinfectant, how to use it to sanitize, how to use it to deodorize, and we want to follow those directions exactly in accordance with the label. There are also other considerations for bleach with regard to eating surfaces. We want to make sure that if we're using bleach on eating surfaces, if it tells us that it needs to be wiped to eliminate any residue, we want to make sure that's being carefully done. So there's some additional steps that may be required when you're using bleach, because it is a product that is a danger and it is a corrosive. We want to make sure we're taking those additional steps. Ventilation is important. If you're going to use bleach, make sure we can allow for proper ventilation. Windows being open, doors being open. If we're using it on a bus, for example, all the windows of the bus should be open. But again, how is this particular product going to react with what other types of surfaces that we're applying it to? If we're using it on a non-porous surface, is it going to potentially damage the seats or damage the surfaces that we're applying it to? So those are some really important considerations when you're using bleach. I wouldn't say that bleach is not allowed. I haven't seen anything in whether it's state statute, EPA, CDC, any guidelines that tell us that we cannot use bleach. However, we just got to make sure that we're being very careful if we are using bleach, and only people who have been trained properly on its hazards and on the health effects of it should be using bleach, especially in schools. A lot of us probably have fond memories growing up of cleaning day at home, and usually especially in northern New Mexico, that meant 89.1 blasting on the radio or Spanish music playing and the smell of bleach and pine sol. That's at home. That's one thing. In the schools and in work environments, we got to make sure that we're following the labels exactly in accordance to make sure that we're minimizing the risk that we're potentially putting somebody at harm by causing an irritant to them in any way, or corrosive matter with regard to use of these products. For food contact surfaces, again, we want to make sure that we're following all of the pre-cleaning requirements and all the post-cleaning rinse that may be necessary when we're using these products. All these products, whether it's bleach or any other kind of disinfectant, we want to make sure that we're following the storage and disposal requirements of these products. Where are we storing these? First thing you see here in the biggest bold letters that they have is store away from children. So we want to make sure that kids aren't going to be able to get their hands on these products. If you're going to have kids involved in the cleaning process at school, which we kind of would discourage, if possible, to have children involved in the cleaning process, unless you're taking the extra precautions of making sure that they are not coming into contact with any of the disinfectants or sanitizing products, any of those chemicals, only using products that are intended as cleaners, like soap and water, for example. If kids are going to be involved in the process, have the soap and water available for them to use, or use a cleaner that doesn't have the disinfectant and the sanitizer chemicals in them that could potentially be hazardous. One good solution, or one idea that I found on a forum, was to have kids bring in baby wipes. Instead of maybe the sanitization wipes, they can bring in baby wipes to clean the surface that they're going to eat on. The baby wipes could be used to clean the surface. That's, again, cleaning is going to remove the germs. It's not necessarily going to kill the germs, but if it's my desk and I'm the only one that's been sitting on it and I'm 6 feet away from everyone else and I've washed my hands and I've got my mask on, I'm just cleaning the dirt and the impurities that are on my surface before I eat there. At some point, somebody's going to come back and sanitize and disinfect, but for that particular moment, I'm cleaning my surface with something that's not harmful if I'm the student, by using the baby wipes, by using soap and water, by using some of those methods. Same could be true for staff in between classes, using products like baby wipes, using products like soap and water, which are less harmful. It's still going to help remove those germs and impurities. It's one additional step in the process, but we still want to increase our frequency of disinfecting and sanitizing in between those periods, or at the end of the day, or when it's safe to do so, with proper ventilation and with proper worker protections. So ventilation while cleaning and disinfecting is critical. Any new products that are introduced to the school we need to use training, safety data sheets, and personal protective equipment. That's going to be an issue this year as supply chains are strained. That product that you're using at your school in your district may not always be available when you go to place that order. You may have to go to Plan B or even Plan C on your list of products. So anytime a new product is introduced, we want to make sure that everybody that's using that product is trained properly on its hazards, how to read the safety data sheet, how to read the label, what information is on there, and what personal protective equipment I need to use to protect myself when I'm using that product. So bear that in mind, especially our administrators, anyone who's responsible for purchasing products. You want to make sure that any new products that are introduced are properly trained. We're properly training our staff on the usage of them. I've got some information in here for bus personnel. This, again, a lot of this applies the same as it would in a classroom or in an office setting. We want daily sanitization of surfaces and frequently touched items, or as frequently as possible. So at the end of the day, we're going to go back and sanitize. We're going to clean objects in between use as much as possible. Cleaning is different from disinfecting. Cleaning is not using the harsh chemicals. It's soap and water, baby wipes, things like that. We can wipe, in the bus, we should be removing trash frequently, wipe the heating and air conditioning vents, dusting and mopping our vehicles, cleaning the windows. Don't forget the windows. Kids touch the windows. They touch the little latches on the windows. So we want to make sure that's an area that's cleaned frequently in between, trips. Clean and either sweep or vacuum the interior in the morning and the evening to make sure that we're removing all those particles from the bus. Let's see, going on to strategies for maintaining a healthy environment. Like I said earlier, the number one thing that we can do to maintain a healthy environment is to make sure that we are frequently enforcing and reinforcing the hand washing etiquette, making sure that we're using soap and water as much as possible. When it's not available, we're using at least a 60% alcohol content hand sanitizer. Hand sanitizers are different from the other sanitizers that I was talking about. Hand sanitizers, because they're intended to use on the human body, are regulated not by the EPA, but by the FDA. They're part of the Food and Drug Administration. And if you've seen in the news headlines recently, there have been about, I think the last number was 80 products that have been added to a list of hand sanitizers that are now considered harmful. So we want to make sure that we're reading labels, making sure that those hand sanitizers that we're using aren't on that list of products that have been prohibited because they are harmful. We can do things to maintain a healthy environment by making sure that we eliminate, by using administrative controls as much as possible, shared objects. If I can avoid students from sharing certain objects, that's less frequency that I have to go back and sanitize in between use of those products. So if we're keeping students in pods, we're keeping students in different cohorts, that allows you then to minimize the contact within those groups and then go back and do your daily sanitizing at the end of the day or at the end of the 2-day period when you do your deep clean. Ventilation is also helpful. The more fresh air that we have in the room, in a particular environment, the less concentration of potential germs, viruses, bacteria that's floating around. So that's why, our outdoor dining is safer than indoor dining. If we go to a restaurant, for example, the more fresh air you have available to you, the more it is going to help with getting the air quality improved in the room. Water systems, we want to make sure that as you're going back into your schools, check your water systems. Make sure, one of the things that we just recently saw in one of our buildings, a school that we went out to take a look at, the particular building was not used since March, since the shutdown occurred and everybody was sent home. The stay-at-home orders were enacted. So drains were not properly cleared. If you have a particular area of your school that hasn't been used for a while, if no one's used the men's restroom in B hall for 6 months and you go back and flush that toilet, there's going to be contaminants that are potentially in that P-trap that are now going to be released into the air, and that could be harmful depending on what kind of gas is built up in those systems. So you want to make sure that as you're getting ready to go back into schools, that water systems are properly flushed and disinfected. We're flushing our systems by going in, turning on faucets, going in, flushing toilets, all those areas that we haven't touched for a while, cleaning those water systems up. Other things that we can do for our water systems, administrative controls. For example, I've heard in many areas the water fountains are either being disabled or we're converting those into touchless water systems that can allow us to fill up a water bottle. Or in some areas, I'm hearing about attendees that are now going to be stationed at the water systems to fill up those water bottles. That's an area, again, where germs can potentially spread because unless we're there disinfecting and cleaning in between everyone that uses it, it's going to be an area that gets contaminated as soon as the first person comes up to it. So water systems play a critical role in this, making sure that we have access to the water and also making sure that the water is safe because we've gone through the process of cleaning and disinfecting. Other things that we can do, modify layouts to help reduce the amount of people that are coming and going from our areas. And we've got some training videos on a lot of these issues that we're publishing. We have a Vimeo site. Palms & Associates has a Vimeo page that we've included some 15-minute toolbox talk training videos for a lot of these topics, including cleaning and disinfecting, putting on PPE, taking it off, socially distancing or modifying layouts is going to be added to that content channel. And we have one on reading labels and safety data sheets on our channel as well. So if you'd like more information about that, let me know. Physical barriers and guides. These are other strategies that we can use in conjunction with our cleaning and disinfecting to help reduce the chance of exposure. So these are things that we can also take into place or put in place as methods to help us. These are some of the sites that I mentioned. For example, the cleaning and disinfecting information that most of this presentation was built from came from the EPA, their website. They have a guidance for cleaning and disinfecting public spaces. The List N is available through this particular link here, so you can access those products that I mentioned. The EPA Design for the Environment list that you can cross-reference against your List N to see if you can find products that are less harmful is available through this link. And then other thing that I'll talk about is the use of fumigation or wide area spraying to help control COVID-19. A lot of people think if we just can get somebody to come in and just top to bottom, ceiling to floor, corner to corner, spray every surface in our room, we're going to kill every potential virus that's in here. That's not necessarily true, okay? And the EPA actually is saying, and if you click on this link, it'll take you to a website that tells you that the use of fumigation or wide area spraying is not advised by the EPA. What they're talking about is just making sure that the surfaces that we're coming into frequent contact with are cleaned and disinfected. The use of fumigation or wide area spraying can be done. However, there are hazards that creates that we want to make sure that we're not putting people in harm's way by doing something that we think is being more helpful to all of us. So for example, if I'm applying a fumigation, if I'm applying a wide area sprayer, there's certain chemicals that need to go in that sprayer and other chemicals that are not allowed to be used in a sprayer like that. There's also safety considerations for the person that's operating that sprayer. How close am I to the area where the spray is being disseminated from? what kind of protection do I need from it? Are just regular rubber gloves good enough, or do I maybe need nitrile gloves? Do I need to have a respirator on when I'm using this particular wide area sprayer? A lot of these things are available for you to purchase, but they don't tell you what comes along with it. And that's all the training requirements and the special products that should be applied using these sprayers. So if you are going to use any kind of apparatus, any kind of equipment like that, first of all, none of that has been proven by the EPA, tested by the EPA to improve safety or efficacy. If you're going to use those products, follow the manufacturer's directions accordingly. And I would go as far as having whoever it is that's selling you the product come out and train you on how to use that equipment. If it's Brady or whoever it is that you're buying that sprayer from, have them send a representative to your school to train the people who are going to be using that equipment on how to properly mix the chemicals in it, how to protect themselves from the hazards associated with it, and how to apply those products. And if there are any considerations for post-application cleaning. So I've seen one model that shows a wide area sprayer used, and that requires staff to go back in and wipe all the surfaces after it's been sprayed. Well, that's fine, but we got to make sure that we're doing that extra step. If not, there's residue that could stay on the surface that if I come into contact with it that in the next couple of hours could then be transferred to my eyes, ears, nose. And we all know that kids are going to touch every part of their face with their hands all the time. And that's going to be one of the big things that we're going to be trying to fight all year long is keeping kids' hands off of their faces and each other's faces. I've got 3 kids, so I know how that goes. Anyway, let's, at this point, are there any questions that anyone has? Is there anything that I haven't covered or anything that I've covered too quickly that anyone would like to talk about?
Thank you so much, Larry, for your presentation. It looks like we do have one question in the chat box. What about swamp coolers and air filters? How concerned should I be about the air quality in my poorly ventilated classroom?
That's a great question, and the answer to that is there's not been any research, any data that's shown that the virus is being transmitted in a way that is getting into heating, ventilation, and air conditioning equipment, and then being broadcast in any way that's been harmful. That doesn't mean that it hasn't happened or can't happen, but there is no data to support that particular hazard from occurring. So some of the things that you can do to protect yourself in those situations is, again, to try to increase as much as possible your ventilation so that you've got as much airflow from your natural resources as possible. So if that means opening more windows, keeping the door potentially open if you can. Again, depending on what kind of door it is, that may not be advisable and it may not be safe. If you've got a fire-rated door, for example, fire-rated doors shouldn't be propped open using disabling blocks because fire-rated doors are intended to help keep fire from spreading. However, if you have that conversation with your fire marshals and let them know that this is potentially what we're going to do to increase ventilation, that could help with any issues with fire inspections. But again, it's still potentially creating a hazard, so you'd want to make sure that somebody's responsible if there is an emergency for disabling that block or that doorstop that's kept that door open. But increasing ventilation as much as possible, changing filters as frequently as possible, those are things that can be done to help with that concern. And it hasn't necessarily been shown to be a hazard yet, so there's not a lot of guidance out there for that particular scenario because we haven't seen that being as harmful. What we're seeing is the virus is being spread more often from close personal interaction with somebody's respiratory droplets, and we haven't seen that the respiratory droplets are necessarily getting into our ventilation systems and being spread in that manner.
Thank you so much, Larry. Our next question is, what is your take on UV sanitizer wands used by itself or in conjunction with cleaning? Do you have any experience with these?
So UV sanitizers are, again, those are equipment, and equipment is not registered through the EPA. So there have been no studies, there have been no EPA guidance that have come out with regard to its efficacy. It doesn't mean that, the UV wands or the UV lights aren't effective. If you've got a particular product that's shown they've got some sort of scientific model that they've proven some sort of efficacy, I would say those types of things could be used in conjunction with your cleaning and disinfecting. But the cleaning and disinfecting, the hand washing, the respiratory etiquette, the social distancing, those are all the things that are going to be the most critical. If we choose to take those additional steps like the UV lights, those can be used. Everyone that I've spoken to, from the EPA to the State Department of Agriculture, have told us, though, that they don't necessarily feel that those are as important as those other issues. In fact, we did a webinar last Monday, with representatives from the EPA, and we had a couple of companies that sell a lot of these products, a lot of this equipment, that were on our webinar with us. And one of them made a candid comment, and he said, "I know this is going to, maybe not what my boss wants to hear, because we're taking away potential sales. But if I were in the position of making the decision to purchase UV lights or products using equipment to clean and disinfect, I would save my money. I would invest rather in cleaning products and time to train staff on how to properly use them." He admitted candidly that he wouldn't necessarily buy that additional equipment. So it's not that it's bad. It's just may not be necessary. The more is better approach when it comes to cleaning and disinfecting isn't necessarily true. More is not always better. So just because we're taking an extra step or doing something in addition, again, just going back to just doing what we have control over and doing it properly, cleaning frequently, disinfecting as necessary. Those are steps that can be taken to help reduce the potential for virus spread.
Thank you. And Larry, can you speak to what type of soap is best for the soap and water spray bottles in a classroom?
Sure, absolutely. So let me just go back to my notes here for a second, because with regard to soap, I had a particular mixture that I had reference to. So 1 teaspoon of fragrance-free dish soap in a spray bottle filled with water. 1 teaspoon of fragrance-free. And the reason why you'd want to use fragrance-free is, again, potential irritants. Is the smell of my lemony fresh Dawn going to affect somebody? Is it going to be an irritant to any kind of breathing condition? So as much as possible, using a fragrance-free, I'm having trouble spitting that term out, fragrance-free dish soap in a spray bottle with water is effective. And again, we want to make sure that we're spraying it on the surface. You can use a paper towel, you can use a microfiber cloth, whatever you want to use, but there is probably going to be a rinse and a wipe process that's going to be involved with that. Because if you spray soap on a surface and don't wipe it, it could get sticky. So you want to make sure that you're also going back and using some sort of post-spray wiping process to make sure that you're removing any residue from the soap. I hope that answered the question.
Thank you. And there's another question. Is there a difference between the words disinfecting and sanitizing? And are they used for different surfaces, such as work versus eating?
There is. Sanitizing usually refers to eating surfaces. Disinfectant is more with regard to killing of germs. And so they're not necessarily used interchangeably. They can. There is a difference between the two terms. A sanitizer usually will have less of a dwell time and less contact time for it to be effective. The disinfectant usually has to be applied for a longer period of time. Some disinfectants are not intended for use on food surfaces, but most of your sanitizers are. But again, you want to refer to the label just to confirm that the product that you're choosing is going to be used, is safe to use on an eating surface. And I'll go back, to the example that I showed, that the 2 different types of wipes on these labels here, and these are just products that I have lying around my house. So this was, a Lysol wipe, and it said it's not intended for eating surfaces. This one does have the use of an eating surface. The intended use would be for eating surfaces. So, really, you got to go back and read the label. A lot of your disinfectants can be used as sanitizers, and a lot of your sanitizers can also be used as disinfectants. It's just a matter of how you apply them and what they're intended for. And it is, critical to read, is it a porous or non-porous surface? And is it, what the dwell time and what the contact time is required for that. And a lot of these products, they require the product to remain wet, and that can be difficult, especially, when it's 100 degrees outside, and, I know your rooms sometimes may be poorly ventilated. As soon as you apply the product, it may dry and may start to absorb. We've got to follow those directions. If it says for it to maintain for 2 minutes, it needs to stay wet for 2 minutes. If we're applying with a wipe and the wipe starts to dry out, we got to toss that wipe and go get a different wipe, because it's going to be necessary that we keep that surface wet for the period of time that's required in order to solve or to accomplish the things that we're starting out to accomplish.
Thank you for that clarification. And how about running HVAC systems that have been shut down for a while? Should you do it prior to cleaning and disinfecting?
Yeah, and I would say go back to whatever your process was, pre-COVID. What did we do to get schools ready in the summertime before kids came in? And that a lot of those processes were the same. We're changing out our filters, we're running our systems, we're testing them to make sure that they're working. Are there any leaks? Are there any areas of concern that we need to put in work orders for? It would be the same method that you're using in between, your winter break, your spring break, anytime that the buildings are going to be shut down for a period of time. The same precautions should be taken with this scenario. We're going to go back and make sure that everything's working, and as much as possible, cleaning it out and running those systems prior to anybody coming in. And the same thing applies, if you have somebody who develops a positive case after the school year starts. What the CDC and what New Mexico PED requirements are telling us are we need to shut down that portion of the facility that we know that we had close contact, that we had somebody who was potentially infected or suspected positive test, shut it down for at least 24 hours. They say at least 24 hours because that allows for any respiratory droplets that have been spread in the air to then settle and dissipate in the room. Then we come in and clean and disinfect before reopening. If it's not possible to keep it shut down for 24 hours, they're saying to shut down for as long as possible. So you may have some critical infrastructure that doesn't allow you to be shut down for 24 hours. And if that's the case, you shut down for as long as possible and then come in and clean and disinfect. But again, it's, if possible, 24 hours to allow for the air to settle. That allows for anything that's potentially airborne to land, and then we can come back and wipe those surfaces, clean and disinfect those surfaces. That's the protocol for if you have a positive case in your facility.
Okay, thank you.
The more you know where that positive case potentially traveled, also that tells you that's more area that needs to be cleaned. So if we don't know if you have, let's say, the positive case is somebody like a custodian who's gone into every classroom, gone into every building in the facility, every room in the facility, that entire facility needs to be shut down. But if I know that it was, the math teacher in room B, and she only stayed in that room, and also the office and the teacher's lounge, now we know that those areas are the ones that we need to shut down or spend our extra time disinfecting.
Another question we have about the killing of the virus is, it says outdoors, PE, softball gloves, bats, etc. Will the sun kill off the virus between class changes?
So that's actually something that the EPA and the CDC are advising, is that natural UV lights, that natural sunlight is actually reducing the amount of time that the virus stays alive on surfaces. And so your outdoor equipment, your outdoor, exercise, that type of stuff is going to be a little bit safer, and less disinfectant is going to be required in those areas because of that fact that you do have the natural UV light. Now, again, what you have to think about is what type of usage do you have on that playground equipment? How frequent is the traffic? Who's using it? Am I using the playground equipment? Am I changing groups frequently? Or is there a difference in the amount of hand contact to the surfaces? So what can we do administratively? First of all, let's start by setting up a rotation schedule where there's less contact with that outdoor equipment, or less contact with those shared items as much as possible. And we do that by keeping, again, the groups of kids, the cohorts together as much as possible. Hand washing. If I wash my hands before I go out on the playground, now those surfaces that I'm touching should have less contaminants that I'm transferring because I've washed my hands. But kids are kids. They're going to wipe their nose, they're going to cough, they're going to touch their ears and eyes, and then they're going to touch those surfaces. Do I have to go back and disinfect after everyone touches a surface? Not necessarily. You've got to look at, again, what's the frequency of contact? If I've got kids that are going to go from one recess, we're going to ring a bell, and then the next group is going to come out immediately following, do I have 4 minutes or 6 minutes or 10 minutes or whatever my dwell time is for the disinfectant for that to dry before the next group of kids comes out? Or am I now putting those kids potentially in harm because I'm applying a chemical that they're going to come into contact with? Maybe it creates a slippery surface and they fall off the equipment, or maybe they touch that cleaning product and transfer it to their eyes or nose by wiping their face. So I want to also balance that method of cleaning and disinfecting outdoors. Can I go back through the playground equipment, maybe with soap and water, with my soap and water mixture, and clean that equipment between use instead of using a chemical that may potentially create a slippery surface? But even with soap, like I said, if it's not wiped properly, could still create that slippery surface. So the hand washing and the social etiquettes are really going to be more important on the playground, and that's going to be the challenge, is keeping kids distanced while they're out on the playground equipment. But as much as possible, close contact is defined by the CDC as more than 15 minutes in closer than 6 foot distance from somebody. So if I'm within 6 feet apart from somebody for more than 15 minutes. So if two kids run into each other getting off the swing set, that's not necessarily close contact. Close contact is them being less than 6 feet apart for 15 minutes at a time. So if it's just brief interaction as they're running through the playground, that's one thing, but we want to try to, as much as possible, minimize that close interaction with each other. Even with the mask, the mask is not 100% going to keep every potential germ at bay. It's a great deterrent and it's a great way to reduce spread, but nothing is going to completely eliminate every risk, except for all of us staying home and shutting all of our doors. And even that doesn't work, because we still got to get food and medicine and things like that. So we're still going to have the potential risk. It's just how we minimize the risk. And one way that we can do it is by our administrative controls. The other way is by taking the cleaning and disinfecting methods, but applying them in a way that's safe, so that we're not creating additional harm.
Okay.
That was a long-winded answer to that question.
No, thank you for your thorough answer. And I think your response relates to the next question. And will sanitizing hands before and after music allow us to use the instruments?
So, with musical instruments, with anything that we're going to be doing, singing, any sort of activity that's going to produce extraordinary amount of air from coming out of our bodies, there's going to be that potential risk. I have seen, and I'm not endorsing this, and I'm not saying that this is something that everyone should run out and buy, but I've actually seen some different types of physical barriers that are being used by music teachers, by orchestra directors, to protect or to kind of keep the person that's using a musical instrument in sort of a bubble so that their respiratory droplets don't spread. The hand washing is great. That's important, because if I'm touching objects, that's a way that I'm transferring those germs. But also it's the air that's being released. So if it's any kind of instrument that requires wind, that's obviously going to increase our potential for those respiratory droplets to spread if I'm doing that. My daughter plays the violin, and so her contact is going to be with surfaces. She's going to be touching things, but the person that's sitting next to her playing the flute or some other instrument where there's air being forced, that's going to be a greater risk. So one way that you can do that is through hand washing. But again, the risk really for music and what's really concerning is going to be the respiratory droplets that could be released when we're using wind. I hope that answered that question. That was from a novice music parent.
There is a follow-up to the question. They were talking specifically about a drum. And I'm guessing that would be similar to like the violin, where you're saying they may not necessarily be blowing on the instrument, or but you still need to be concerned about those droplets falling onto the item. Yeah, and so the social distancing, keeping each other 6 feet apart, and then any kind of hand washing for shared objects. I wouldn't necessarily wouldn't suggest wearing gloves. I'm very leery of when we're walking around with gloves on, because it's no different really than our clean skin. As soon as we touch something, even if we've got gloves on, we're now transferring whatever that contaminant was to every other object that we touch. So gloves aren't necessarily the answer either. So hand washing is critical for the shared objects, but also maintaining the social distancing and the respiratory etiquette. Keeping our masks on while we're doing that will help as well. Another question is in relation to how long the virus lives on surfaces. Do you know if it lives on any surfaces for greater than 72 hours?
So the standard answer from the EPA and from CDC research that is available right now on their website is that they're saying that the virus can live up to 7 days. Now that information does change periodically, but the last thing that I looked at said up to 7 days is the amount of time that a virus can live on the surface. That doesn't mean it always lives for 7 days, but it can potentially live for up to 7 days. So what they're advising is if a building has been unoccupied for more than 7 days, then just routine cleaning is necessary. If it's been occupied or used within the 7-day period, then additional disinfectant should be done before resuming operations in that room. So before kids come back to your classroom, if nobody's been in there, the room should be disinfected if it's been 7 days or less. If it's been more than 7 days, it just needs to be cleaned.
And Larry, I don't know if you can speak to this, but there is a question that says, how realistic is hybrid reopening in the next month? And I know there was just a recent announcement that won't allow any in-person learning until after Labor Day. But do you have any thoughts on that question?
I really don't, other than what would be, my own personal opinion on that. And I really don't want to interject that into this conversation. I do think that that there is a great opportunity here for us all to use this period of online learning to increase the amount of training and increase the amount of education, so that whenever we do go back into schools, whenever that may happen, whether it's hybrid or fully re-entry, whenever that happens and however that looks like, the more we can utilize this period of time now to get educated and to understand the hazards and how to reduce them, the greater that opportunity is for us. Palms and Associates does have, somebody asked a question about training, if we're going to do training. We do have a channel available that has a lot of the content that I've been discussing, not just in the cleaning and disinfecting, but also personal protective equipment, social distancing. We've got a channel, a Vimeo channel available to all NIPSIA members. We've got a lot of webinars that we've done over the summer. Our company has taken, almost since the beginning of the stay-at-home order, we've kind of taken the challenge as a whole, as a company, we're a national company, of creating a series of webinars, different topics from reentry to developing plans for human resources, safety, security. James did a webinar last week on social unrest and what security could look like and safety in a period of social unrest. And so we've taken this topic and we've done these webinars. Those are all available. They're all recorded content that's available for free to anybody on our website at any time. If you go to www.palmsassociates.com, you'll find a link to all of our webinars that we've created. We've done them in conjunction with our office out in Woodland Hills, California, our sister office out there. We're a company that has national exposure, and so that's something that we've done all summer long. So just to try to get as much information out there as possible, I would just say that's going to really help in this period of time between online learning and whenever hybrid or whatever the next step looks like.
Thank you for those comments. We talked a little bit about outdoor and I apologize for the background noise. We talked a little bit about outdoor sports equipment. Can you speak to indoor equipment such as volleyballs or basketballs?
And again, so, any kind of shared objects, the more hands that are touching that object, the more frequently that we need to clean and disinfect. So the cleaning part of it is really something that you could be doing in between use. So soap and water, wiping them down, in between use will help remove germs and potential bacteria and virus from the object, and then periodic sanitization or disinfectant, depending on the type of surface. Okay, so if it's a leather ball, for example, you may not use the same wipe that you would use on your countertops on the leather ball. You need to read the label and find out, is this for use on a porous surface or a non-porous surface? If it's something that if it's a spray, how long does the spray need to stay on the object in order for it to be efficient? What's the efficacy? What's the dwell time for that product? But I would say the disinfectant should take place, especially on objects that could remain wet, like fabric material, ball that may have a cover on it, something like that. I would do that not as frequently as you're going to clean. cleaning should be your focus on those, cleaning them more frequently. And again, washing our hands. Have the kids wash their hands before they start handling the objects that they're going to share and after they're done sharing them. The frequent hand washing is really going to be critical. That's number one on our list for steps that we can take to help reduce virus spread.
Thank you. And it looks like Jim included a comment to everyone in reference to maintaining cleaning and PPE supplies. If your regular suppliers have run out of these supplies and your backup suppliers are also not able to help, you can make a request for supplies through FEMA, but you must go through your county emergency manager to initiate that process. And those are available on a case-by-case basis. Thank you, Jim. Let's see.
CES also had some guidance that came out with regard to ordering cleaning products, and those are two of the handouts that we made available that are in the chat box. Some of the guidance that they're recommending is when you're ordering products, take a look at what you ordered last year. Don't over order. In other words, take a look at what you ordered last year, determine how much of an increase that's going to require for you to do your additional cleaning, but don't try to buy your whole year's worth of cleaning products all at once. If everyone out there goes out and tries to buy a year's worth of cleaning products in September, we're going to have the same issue we had with toilet paper. We're not going to be able to find things because the shelves are going to be stripped bare. We need to try to help maintain that natural flow of product, that supply chain, by only ordering what we need, but make sure that you are getting what you need to increase your frequency of cleaning. But if it was a 2 to 4 week delivery time before, expect that now to be a 4 to 6 week delivery time. Those delivery times have increased. We've sent out a survey. We're trying to figure out exactly get our hand on the pulse of how bad the situation is statewide. So we've sent out a survey to all the districts to find out kind of what's going on in terms of supply chain, and just trying to help each other be, a source for information.
Thank you for that comment. There is a question about using a face shield versus a face mask. Can one be used over the other? And they do note that they realize using both is good.
Yeah, absolutely. Using both is definitely going to be, the safest. I would say if a face shield, and I think the CDC has some guidance on their website that says face shields should not necessarily be a replacement to face masks. However, if they are going to be used as a replacement, you want to make sure that you are in some way creating a shield. And I don't think I have mine. No, I left mine in the other room. But if you're wearing a face shield, maybe putting a scarf around the bottom of it to make sure that whatever respiratory droplets are coming out aren't going to be disseminated through the openings that you have in that face shield. The face mask is going to give you the most protection, or give the most barrier, because it's going to be sealed or closer to the face than the face shield. You want to eliminate any openings if possible if you are using the face shield. I know in the PED reentry requirements it does say face mask or face shield should be worn, but the CDC website actually has an article in there that talks about face shields not being as effective as face masks.
Thank you, Larry. And I'd just like to add to that you are correct that the current version of the guidance does say either or. We are working on some follow-up guidance to masks saying that the face shield alone should only be used in those really unique circumstances, as you're saying, where a mask cannot be worn, where the mask that seals around the nose and mouth is absolutely preferable, and the face shields without additional protection should only be worn for those that have a medical reason or other reason to do so.
Yeah, I would definitely agree with that.
Can the training be used for children as well, or is it primarily for adults? And I'm not sure if that training is in relation to the use of cleaning products or the POMS training.
So I would say the training is specifically designed to adults. Our primary audience at POMS and Associates is to train staff. So it's not necessarily for training students. I would say there probably is information that could be relevant to students, especially, when we get to that, we're going to be recording a video on hand washing, which will be a really short, 3 minutes or less video on proper hand washing techniques. We're going to include that in our video channel. How to put on and take off face masks and gloves is something that I think would be relevant to students. I would really advise against using students to apply chemicals, and we talked about the hazards associated with that. I would really steer people away from that whenever possible. I know that there probably are some circumstances where that becomes relevant and it becomes something that is done. We can't tell you what to do and what not to do, but if you're going to do it, make sure that students are properly trained, and our videos could potentially be used for that. If you have like a vocational class or something like that where you are going to have students who are going to be responsible for cleaning their areas, sure, absolutely. I think you could use our videos to relay that information. But I would caution against using the videos as a way to train students to apply cleaning products, because we don't really want your students doing that. I did notice one question in the chat box about how to access the content on our video channel. So it is a link that we can send you, and I think Jim put his email address on there. Feel free to reach out to either one of us, and we can email you the link to it's a channel on Vimeo that you can that we're adding additional content to, but you can access the training that we talked about on the Vimeo channel. And then we also, the webinar that we did last week, it was a 2-hour webinar. EPA, State Department of Agriculture, there was somebody from Department of Health on the line with us, Brady Supplies, and Mooring USA. So we had a good roundtable discussion, a panel discussion on cleaning and disinfecting. That's available on a separate Vimeo channel that we can send you if anyone would like to see that. I did also watch just last night on it's on a website through the Department of Agriculture. No, I'm sorry, it's through the EPA. They have a webinar that's available on their website. If you go to the national NPIO, which is the National Product, I forget what the acronym, what the I and the O are, but NPIO and NPRO will give you different access to websites that the EPA has produced, and they've got some really good cleaning and disinfecting webinars also. But a lot of this information is pretty universal, and a lot of the same common elements are included from the CDC and the EPA are two pretty good sources for information. Some of the CDC guidance changed last week, and so it's important to stay up to speed on it. If you read something from CDC earlier this summer, you might want to go back and revisit it, because some of that guidance they've added additional guidance, and some of it has changed a little bit.